There is a population of people. They fascinate, irritate, and are like ghosts, shape-shifting and disappearing into their surroundings. They are the high intelligent, gifted population. Intellect is only one part of who they are, and we hope to uncover the complexities with which they live their life. Here we start a new conversation. Join us as we delve into the world of intelligence. Perhaps you will discover a child, a neighbor, friend, or yourself in this conversation. Hi, I'm Cindy Dickman, your host for Rethinking Intelligence. I am so excited that you are here today because this is the first time I'm able to bring you an interview. And this proves to be an important one as I see this more and more in my clients and my clients' children. It is visual processing disorders within the high intelligence community. Not something that we would typically associate with it, but it is there and often flies under the radar. And it could, interestingly, attribute to the diagnoses and complexities that we often see with this brain type. Anything from anxiety, dyslexia, poor academic achievement, all the way to ADHD. So without further ado, let's jump in with Dr. David and learn more about this incredibly important topic. Today I'm here with a really special guest named Dr. David Antonyan, who is with Vivid Visions in Santa Clarita, California. And I am just so glad to have you here today, so welcome.
Thank you for having me. It's a pleasure.
And why I wanted to have you on is there's an area with the high intelligence population that we typically don't think of, and that is visual processing disorder. You are one of the specialists that I have found in this area within the LA region. And so I wanted to come and talk with you because you've personally helped me. So can you give me a little bit about your background, why you even got into this area?
Sure. So the field that we're talking about discussing here has to do with our vision, has to do with our binocular vision, which is the way we perceive the world around us by using our both eyes at the same time. And it's an issue that is very common, yet most of the population is undiagnosed and uncorrected because the medical system, the eye care system, performs eye evaluations with one eye open at a time. So they miss these important functions of our vision that we need to perform these, typical daily tasks that we're doing. And if you struggle with your binocular vision, then you have these issues, you have these difficulties in life, and it's very difficult for you to understand the world, perceive the world correctly, and then react with the world. So maneuver and go around and perform these tasks. So I myself have had these issues my whole life from birth, and it's genetic in my case, and I've dealt with it for 28 years until I diagnosed it myself in me. And I discovered this issue in myself when I was in optometry school at the end of it, during rotations when we're seeing patients, and I recognized my own symptoms in my patient. And then after performing her evaluations and helping her out with the corrections, I wanted to do these tests on myself with the specialist at the school, and she confirmed my diagnosis, my condition, and helped me prescribe myself these small amount of prisms that, despite having perfect vision myself, it made a tremendous difference in the way I perceive the world and the way I am in the world and the way I function. So growing up, I had difficulties with coordination, with balance, with sports, with walking, with throwing, with catching, reading, learning, skipping lines, losing my place. But kind of what we were talking about earlier, I still wanted to learn. I still wanted to succeed. I still wanted to reach my goals. And I was very ambitious, so I didn't let that stop me. And, the brain, when you really want to get things done, continuously tries to figure out ways to compensate for the issues.
Yes.
So I compensated my whole life. I'd be exhausted at the end of the day, headaches and migraines and the dizziness and all the symptoms that I talk about now. So once I discovered this issue in myself and corrected a fraction of it, it made a dramatic difference in my life, and I got obsessed in the field. So most of the learning I've done on binocular vision and correcting binocular vision issues has been after school, after I graduated, finished the boards, got my licensing and everything like that. Most of the learning I did in the field was after that. And it was mostly on my eyes, on my family members' eyes, on my friends' eyes, and then I started prescribing to my patients. And then every patient that I corrected a fraction of this issue and came back saying, "This is the best I've ever seen. You have changed my life. You have changed the world, the way I'm perceiving." And it's insane the type of changes I get to see now on a day-to-day basis, just doing this for people and helping patients. So it had such a profound difference for my life, and all I wanted to do was just give that same difference to others, to my patients.
Yeah.
So that's exactly how I got into the field and how I just dived into it.
I love it. And I'll have to say, from the personal side of things, this is the second time I've seen you, and if you could speak to the changes that I've experienced are not even what I would even consider anything that would have to do with vision, but when you gave me my new prescription, I actually started walking straighter, and which I didn't even know I wasn't walking straight, and my chronic back pain is gone. So can you speak to some of the most interesting things that you have seen down the line that have been corrected in people that you would never even associate with a visual?
Absolutely. So correcting these issues have made, again, dramatic changes in my patients, not just visually, but in behavior, in their moods, in their daily abilities. I've had patients that had TMJ, that had relief of their TMJ because of this, because it was tension all around that same site. I had patients with auditory issues and sensory issues. They're very sensitive to sound. And giving relief in the muscles here, get a relief of their auditory sensitivities. I've had multiple patients, myself included, that were on multiple medications for these symptoms, like Adderall, for example. And I've had patients come off their medications after getting this issue corrected. And it's not one, it's not two. I have multiple patients like that. I've had a change in patients' handwriting immediately after putting in the lenses, where they were writing this much with the spaced apart, and then their spacing changed, their alignment changed as they're writing. So dramatic changes. We've seen a change in the way patients place their foot as they're walking. We see a complete change in posture. And, sometimes we see people that are walking, they're leaning to the side, they're tilting their head to the side. These are just compensations. And correcting these issues corrects those compensations. Now the patient doesn't have to compensate any longer. So then you get a relief in your body, in your back, in your neck, because you don't have to try to do things in a certain way to help you see the world. So yeah, it's been incredible, really, and I've seen
that is.
I myself, like, sometimes when I'm seeing these changes, I'm having a hard time believing in it. I'm like, how is this even working? But
yeah, and I remember in one of our previous conversations, you were mentioning when the eyes aren't aligned and they're perceiving the world in like essentially two different vision fields, so to speak. Right. Your body stays in like a state of fight or flight, and so that's where a lot of your patients come in with anxiety issues and so forth. Can you speak to you kind of mentioned Adderall, which I'm assuming ADHD, right. But are there other diagnoses that people come in with that you see really is remediated by taking care of the...
Absolutely. So migraines, most of the types of headaches, like cluster headaches, sinus headaches, but they couldn't find any kind of sinus issues. Dyslexia, where the patient wasn't really dyslexic, but it had this misalignment, was making reading difficulties. The anxiety parts of things, the panic disorders, derealization, where things don't feel right in your environment. A lot of the mood disorders, PPPD, like postural, dizziness, vertigo, and then like clumsiness, bumping into things, spatial issues, postural issues, neck problems. Like, a lot of these issues are complications of these visual issues because of these compensations that our brain has to do to deal with these issues. So it's just constant stressor on that specific muscle or nerve that's working hard to deal with this issue is creating these symptoms, like cervical instability, for example, and etc. So yeah, so many conditions that we've had patients diagnosed by other specialists that they weren't able to find relief with any of the treatments they tried. They've tried Lyme protocols and mold protocols and vitamins, etc., but they were still dealing with these issues. And then correcting this visual component, this huge component, because 70% of your brain is responsible for processing your vision, has helped a lot of my patients recover from the other conditions they were diagnosed with.
That's amazing. And so can you speak to, since, I'd like to go into like how you see this correlation with the high intelligence population. Because we've talked briefly about, you do see this correlation of people that are coming in. Could you speak a little bit to that you have noticed that, or?
So to be honest with you, the biggest thing I've seen, as far as not maybe high intelligence, but high creativity. I've seen this with high creativity.
There's a correlation between the two. Absolutely.
And the reason that, or I'm sure it has a lot to do with the brain areas that are involved as well. But I feel like part of this creativity comes from where we're not really focused into the real world, right? We're not looking at anything particular. We're not focusing on any kind of text. We're not watching anything.
Our brain is already like 5 steps ahead of where we are.
Right.
Yeah.
So our brain is kind of like in a different world, despite us being in this location and doing this activity. Our brain is in a different world, in a different area, and is thinking about different things. A lot of these issues I noticed is happening when the brain is so overworked from compensating with the muscles and the nerves. So it relaxes the muscles and the nerves, so it spaces out. It's like checks out.
Yeah.
And then during that time, I see this creative process is flowing. This creativity flowing, because again, like you're working on a task, you're focused visually,
so that
you're not you're locked in at whatever task you're doing. But if you're seeing blurry, hazy, you're not even present in your current environment, that's when your creativity wanders.
So it's kind of an interesting, in order to get to that creative place,
you have to have a dysfunction almost.
Have a dysfunction, but you're not saying that creativity is going to go away if you correct your visual processing.
No, not necessarily. No, not necessarily. But for example, one of the things that we see in research and we constantly hear is how patients feel less creative with Adderall and the stimulants that they take. They're more locked in, they're more focused on whatever test they're doing, but the whole creative side of things is dulled down. So, and it's really interesting because you do see it in these instances where the more erratic we see the eye movements, the more creative our patients seem to be. It's really wild, but I haven't really seen like an exact correlation.
Yeah, that's so interesting. But have you ever had anyone come back on the off chance and say, "I'm feeling less creative now that my..." No.
But I've had patients come back and say, I'm feeling less autistic with the prism lenses.
That's so fascinating.
But or less ADHD, or I'm having less migraine, but not the creative.
Yeah, because the creativity is still that, like you said, it's a different piece of the brain, but it's this interesting correlation that you see of the relaxing, and then you go into that creative space when your eyes zone out because they're just tired.
Yep.
So fascinating, and I think this is particularly interesting with the high intelligence population, because several of the clients that I have had, I mean more than several that I have worked with, they actually are so low performing or underperforming in school that they are on remedial classes. Parents want to get them 504s. They are not able to read or write or remember or focus. Focusing is a huge issue. But I know when I meet these kids, I know that they have the gifted brain without a doubt. And so it's like, why are they so underperforming? But no one really looks at that correlation of, here's someone who's incredibly capable, but for some reason they can't read or write. Why is that? And so when I actually have sent them to you, and their lives have drastically changed. They now can read and write. They are progressing. They're happy. They're calmer.
Yes.
And so there is this correlation of, and I think oftentimes when we think of this population, that they're just going to excel in academics. And so they have the ability to excel, but there is this roadblock, a limitation that we typically don't look into.
That's right. Yeah, I was a straight A student, but I had to work like 30 times harder than the majority of my class because I would sit down to focus on an assignment and 5-10 minutes into it, my eyes would start burning. I would want to go to sleep and I couldn't finish a page for the life of me. So I'd have to figure out different ways to take in this information, to learn this, any kind of knowledge that I'm taking in. So, I could kind of get to the goal, etc., and accomplish these things. But the typical way, the standard way that was set up in our school system, which is a white paper, a black text online, where your eyes have to really precisely track each word, and you have tracking issues, eye alignment issues, focusing issues. That standard way of teaching does not really work. So that's how you end up having, gifted children, smart children, etc., not being able to excel in this traditional environment because it's not designed for people that have these issues, especially when these issues are not even diagnosed or during exams or even talked about. People don't even know about it.
Yeah, and I think when you're talking with this, I've talked with several people and their kids are like, well, I take them to the eye doctor and they have 20/20. And speaking from personal experience, both of my children have 20/20 vision, but one of them would get sick when he would go to read. He would get nauseous, and he had such an aversion to reading. So can you speak, and this can be one of the last things we talk about, but a little bit to how that is, like how you separate that out, that you can have 20/20 vision but still not process.
Yeah. So the analogy that I give with this is that imagine having perfect tires, but your tires are misaligned. Your tire alignment is off. So your car will wobble around, will veer off to the side, won't be able to stay in the middle of the lane, and it'll be very difficult to control it. You have to be very conscious to make sure that the car is going straight ahead. Because if you let go, the car is going to be veering off to the side, and you're going to have to bring it back. That's the same exact concept with having perfect vision in each individual eye, but having an eye misalignment. You got 20/20, each eye is seeing perfectly clear, but you open both eyes, and now they're pointing in different directions. So as the brain combines these two visual inputs, it gets this incorrect information of where the eye is in space, and that's how it affects the way you perceive your space, your depth, and where things are around you. So you could be struggling, you could be pulling on the muscles, pulling on these cranial nerves to try to control your eyes and get them to point at the same spot. Each eye seeing perfectly clear, but just daily life and daily tasks would be extremely difficult and pretty much impossible in certain cases. So that's why it's a struggle, and that's why it is missed, because these exams are being done while you're sitting in a chair, looking 20 feet away, covering one eye.
Okay. Well, and when you put it that way, it just is so logical and common sense. Well, is there anything else that you would like people to know? I would like you to give, you are on Instagram, right? And so if anyone is interested in learning more about this, and if you're not in the LA area, but what you need to look for, what kind of professional you need to look for, can you let them know?
Absolutely. So I'm constantly talking about this, trying to spread awareness of these issues, of these very commonly missed conditions, and how many conditions can be misdiagnosed because of this. People can find our accounts on any social media platform, just either looking up vividvisionsoptometry or Dr. David Antonyan will be able to find the accounts. And what you would want to look for in a doctor, you would either look for a behavioral optometrist or a neurovisual optometrist or a functional optometrist. There's like many different terms that doctors go by, but you're looking at the duration of the exam, for example. During routine exams takes about 15 minutes. These functional binocular vision exams should take at least an hour and a half. So, the patient should call the office and inquire about binocular vision exam, functional exam, how long is the exam, what kind of treatments are done. And the doctor should offer prescription prism lenses, vision therapy, VR therapy, light therapy, some kind of a therapy along with this, because again, it can be like a perfect vision in each eye, but it's the coordination, the alignment, and this perception that's off, creating these issues.
Perfect. Well, thank you so much for your time today.
Thank you as well.
This is a wealth of information for anyone who listens to it. So thank you so much.
You're welcome. Thank you for having me.